I would like to focus on this question. How does COVID-19 redefine and force us to rethink urban infrastructure need, use, and related social inequalities? I will focus here on three domains of urban infrastructure, which is housing, public space, and transit. First, housing injustice. Urban density is not a problem per se, in our views, in this new COVID epidemic. One of the outbursts of COVID-19 in Spain was in Igualada, a small city of 39,000 residents in Catalonia. It started with an 80 people lunch of healthcare staff from the local hospital. What we have also seen is that urban living in apartment buildings where a large number of residents have the luxury to be able to work from home and live in spacious living spaces are not conducive to the spread of infection. It is overcrowding and unsafe housing conditions that are the problem, together with the concentration of social spatial inequalities in cities. Coronavirus reps through houses that have multiple occupations where families share kitchens and bathrooms. In the UK, for instance, the top 5 most crowded areas in the country have seen 70% more coronavirus cases than the least crowded ones. What we have also seen is that many residents who are forced to living in poor housing conditions have been those who have fled gentrifying and redeveloping neighborhoods of center cities. This is the case here of Chelsea, Massachusetts, just north of Boston, where the rates of infection has been 4 times the rate of the state of Massachusetts, and where residents have been shown to have been displaced from East Boston and now live with poor access to heat, water, and other safe housing because this is the only places that they are able to afford, that they can live in. And at the same time, there are those working in low wages as essential workers. From the point of view of transit injustice, crowded transit systems, yes, facilitate infection, and people today are afraid with good reason to travel by public transport. However, as the pandemic has already highlighted, workers in the food, hospital, or transit industry tend to be majority working class residents who depend on public transit to get to their jobs. In Philadelphia, for instance, a recent study revealed that workers earning less than $25,000 a year are high public transit commuters, around 38% of them. And those earning just the upper bracket are actually another 38% of high public transit commuters. So again, those riding are more at risk of infections, but they are mostly low-income transit-dependent riders. The challenge for cities is that COVID-19 might serve as a political opportunity for conservatives to cut much-needed transit funding. Pre-COVID, transit agencies such as the MBTA in Boston, again, to come back to Boston, were already under huge budget constraints and losses with a close to $37 million of budget deficit. They were struggling to even do basic repairs or modernize lines. What will happen when those agencies need to invest in new cars, in new lines, in safety equipment, when we also know that federal and state departments of transportation are not likely to chip in those much needed dollars? Finally, from the point of view of public space injustice and COVID, our point here is that cities only have very little time to rethink the use of streets as public spaces before the car lobby strikes back. The car industry funds political campaigns, provides thousands of local jobs. So of course, governments will be under increasing pressure to financially support their rebound and make it attractive to ride a car. Just considering the economic impact, in the EU, 1.1 million workers from the automobile manufacturing industry have been affected by factory shutdowns. And so here, our fear is that companies will likely fund large-scale public campaigns around the safety of private vehicles and trying to bring a narrative that says that the only way to be safe from the crisis is to drive your car. Here, cities must rethink what safety in public space means and who has the right to it. And here we are considering not only public spaces as consumption spaces, like those that we see now on the left in Germany, but green public spaces. Those spaces in general in neighborhoods of color, of residents of color, or low-income neighborhoods are smaller, under-maintained, and less numerous. They're also in closer proximity to highways. In that sense, there is kind of a compounding effect of environmental injustices. However, they serve a variety of purposes for fragile residents, especially those who live in cramped living conditions. And here we can also think about their role for socializing for little kids, providing a relief from isolation and loneliness for older residents, and also for women who have been heavily impacted by lockdowns. Our fear here is that there will be too much emphasis on privatized, consumption-driven public spaces, and that there is even a risk of producing more gated communities with this fear of the virus. So cities must consider who will be able to enjoy public spaces post-COVID. If we think about the redevelopment of cities over the last 20 years, a lot of urban neighborhoods have been converted into centers of attractive urban living with multiple types of green spaces, supporting the return to the city of higher income residents, like this green Gentilly neighborhood on the left in New Orleans. And residents of color, low-income residents, have been displaced out. So the question is, who will live in urban centers post-COVID and who will be accessing public spaces? There's also another type of inequity that emerges in the post-COVID urban center life. Who will be able to enjoy public green spaces without increased fear of surveillance, control, and violence? In the US, the recent murder of Ahmaud Arbery while jogging reminded African Americans yet again that streets and green spaces are not safe spaces for them. Their bodies have been historically surveilled, controlled, and segregated. So what will be their space? What will be their right in the city? Especially since the fact that Blacks have also been living under the suspicion of causing harm and contagion. That's a long history here. Also, who will be living in those urban centers if higher income residents decide now again that it's better to live outside the city because it is safer, and cities are traps in a way for residents who are suffering from the COVID crisis or who are under lockdown. So here again, the use of the city urban space might be further compromised by the post-COVID recovery. In the final part of the presentation, I would like to propose some radical progressive alternatives that some groups have been advancing for planning and rethinking urban infrastructure post-COVID. What new imaginations can we propose for cities? First, from the point of view of housing justice, there needs to be a moratorium relief on rents and mortgages and evictions for vulnerable groups. Housing needs to become more decommodified, and there needs to be a minimal guaranteed income, are some cities already discussing. Housing infrastructure, especially public housing, needs to be heavily reinvested in because so many housing agencies have been depleted over the last 2 decades. There's also an opportunity to convert short-term rentals, such as Airbnb rentals, to long-term apartment rentals, so that urban residents regain their rights to the city again, their rights to housing. From the point of view of transit justice, what we have seen is the conversion already of many streets for sustainable mobility. Milan was one of the first cities to announce permanent changes with the widening of sidewalks and 39 kilometers of new bike lanes, together with the removal of lanes for vehicles. Here, however, there might be a competition for street users, knowing that there has been emerging demand for online shopping and delivery to a greater level that has created now a form of competition for drop-off spaces and for the use of sidewalks. If cities construct more bike lanes, the question will also be for whom? Essential workers do not depend on these active mobility infrastructures in general. They live in areas that are more remote, that are more difficult to access, because these are the only areas they are able to afford in heavily expensive global cities like Barcelona or like Milan, for instance. In that sense, they do not have the luxury to use those bike lanes. So here again, a need for funding secure and affordable public transit system as a social equality and transit justice tool. You can already see here the variety of cities that have taken measures to create new rights on streets for pedestrians to get rid of the core dominance that characterize much of their urban development. And that's also here the case in Barcelona, major avenues being converted into these spaces for active mobility. Last, from the point of view of public space and green space justice, there are many strategic interventions that can be put in place. For instance, Barcelona has these superblock programs of pacifying from traffic grids, entire 3x3 blocks. Those might become further planned in the future and already kind of deployed as a way to create new public spaces. There is also a need to balance small network green spaces that are in close proximity and access to residents, with larger spaces that have historically been agoras, have been centers for greater public congregation and also greater access to nature in the city. The problem here is that no matter what intervention is being planned, it will be a competition. It will be a political battle over who has the right to which use and how to control the use. Here, our positioning is that historically marginalized residents, such as people of color or women, should be integrated in the redesign, in the reimagination of public spaces, with public spaces having a great emphasis on care, on access, and on the fulfillment of multiple needs, especially of the needs of vulnerable residents. Urbanism, and green urbanism in particular, should be feminist and should be emancipatory. Last, rooftops should also be reimagined as spaces for new public use and for green developments. These are fantastic opportunities. Just to conclude, yes, COVID-19 is an additional urban environmental justice stressor. What we need is to use it as a game changer for greener and accessible urban infrastructure for all. Thank you.